from Tennessee.
Mr. President, I have 5 requests for committees to meet today during the session of the Senate. They have the approval of the majority and the minority leaders.
Duly noted.
Thank you, Mr. President. Well, Mr. President, for the 6th consecutive year, Obamacare insurance rates are going up, and Democrats are already running around pointing fingers trying to find someone else to blame. About 10 days ago, the distinguished Democratic leader came to the floor, warned that very soon health insurance companies will be announcing higher rates for 2019 in each state across the country, he said, and when they do, many health insurance companies will propose rate increases. And today, several Democratic senators held a press conference saying insurance rates are going to go up in 2019. Well, Mr. President, they're exactly right. Insurance premiums are going to go up in 2019, just like they have for the 5 previous years of Obamacare. But they're exactly wrong about who to blame. Mr. President, the Democrats wrote the bill. They wrote Obamacare. They voted for Obamacare. Every single one of them. Not a single one of us voted for Obamacare. They wrote the bill. If they're looking for someone to blame, they should look in the mirror. Running around and pointing fingers and trying to find someone else to blame is a little like selling somebody a house with a leaky roof and then blaming the new owner for the leaky roof. Democrats built the house with a leaky roof. They built these insurance markets, the individual markets where no one can find insurance. They wrote the sloppy law, and they failed to make the markets competitive, and they erased the ability of consumers to have choice. They didn't follow the law when they paid out cost-sharing payments that were designed to help low-income Americans pay for their out-of-pocket expenses. And this is the very worst, when Republicans were prepared 1 month ago to stabilize these markets, and according to the Oliver Wyman healthcare experts, to lower rates by 40% over 3 years, the Democrats said no. President Trump asked Speaker Ryan, he asked Senator McConnell to put that bipartisan proposal in the omnibus spending bill that passed. The Republicans said yes, and the Democrats said no, and so the rates are going up because Democrats wrote the law and they said no to lowering the rates. What Democrats don't say, but that every American should know very well, is that health insurance rates didn't start increasing when President Trump took office 15 or 16 months ago. Insurance rates have been increasing ever since Obamacare took effect more than 5 years ago. Mr. President, in 2010, there was a big discussion at the Blair House. I was invited to make the Republican case for President Obama, who stayed there all day and listened. And I said respectfully, Mr. President, the Affordable Care Act will not work. I said it directly to him, that Obamacare would send an unfunded Medicaid mandate to states. It did. I said it will cut Medicare by $500 billion. It did. I said there will be new taxes in it. There were. I said it will mean that for millions of Americans, premiums will go up because when people pay those new taxes, premiums go up, and they will also go up because of the government mandates, and they have for 5 years, and now the Democrats are pointing out that their law, which they passed, will now cause rates to go up for the 6th consecutive year. Back then, in 2010, I said our country is too big, too complicated, too decentralized for Washington, D.C., just a few of us here, to write a few rules about remaking 17% of the economy all at once. That's the size of the healthcare economy. That sort of thinking works in the classroom, but doesn't work very well in a big, complicated country, which is the United States of America. Since the Obamacare exchanges opened in 2014, History has proven this, what I said right. The Affordable Care Act has not worked the way Democrats promised. Hasn't worked that way for Marty, a farmer in Tennessee who stalked me at the Chick-fil-A last December. She wanted to tell me that before Obamacare, her rates were $300 a month. She's in the individual market. She doesn't get a subsidy. She pays for these rates herself. This year it's $1,300. Next year it'll be more. Rates in Tennessee for people like Marty went up 58% this past year. That's a lot of money. People can't afford that. She's one of thousands of others in Tennessee who've seen their premiums increase 176% since 2013, the year before the Obamacare marketplaces opened. The Affordable Care Act hasn't worked for the 9 million Americans like Marty who purchased their health insurance in the individual market. They receive no government subsidy. They've been hammered by skyrocketing insurance premiums, and the Democrats come to the floor and say, well, they're going up for the 6th straight year. If I were them, I'd want to keep that quiet. But no, they're looking for somebody to blame. They don't want to look in the mirror. They wrote the bill. They're the reason the rates are going up. They've rejected any reasonable attempt to change the law. They won't even support changes that they're for, that they know aren't working. The Affordable Care Act does not work because it is too Washington, D.C. focused. It has made insurance too expensive. It's hurting the American people. So last year, Republicans tried to repeal the law to help make health insurance work again for people like Marty, the farmer who I met at Chick-fil-A. We came up short. And while I hope that Senators Graham and Cassidy can build a coalition to try again, there's still the urgent problem of skyrocketing Obamacare premiums. It did not have to be this way. The senator from Washington, Senator Murray, and I, she's the lead Democrat on the Senate Health Committee, last year announced we would hold hearings to see if there were steps that Congress could take to stabilize and strengthen the individual health insurance markets so that Americans could buy insurance at affordable prices in 2019. President Trump called me in August of 2017. President Trump called me in August of last year, and he asked me to work with Senator Murray and try to come up with a temporary solution so people who were hurt by the skyrocketing Obamacare prices would not be hurt, while Congress concluded what to do in the long term. So, in September, our committee hosted 4 bipartisan hearings. We invited all the senators to come to meetings before the hearings, and Mr. President, we had about half of the members of the United States Senate involved in those meetings and hearings. And out of those meetings and hearings, we came up with 3 proposals that Congress could pass that would temporarily lower rates over the next 3 years, according to Oliver Wyman, one of the most well-respected healthcare experts in the country, by up to 40% over those 3 years. Number one, our proposal, 3 years of reinsurance grants at $10 billion a year, so states could create funds to insure the needs of the very sick. You take the very sick out of the pool, care for them, and then you can lower the rates for everyone else in the individual market. 3 years at $10 billion a year. That was the first proposal. Second, 3 years of cost-sharing reduction subsidies to help low-income Americans pay out-of-pocket expenses. It's counterintuitive, but when you pay those expenses, you actually lower the deficit. You lower the cost to taxpayers because it lowers the premiums, and that lowers the subsidies, and so you actually save taxpayer money when you pay those 3 years of cost-sharing subsidies. And then 3, we took a provision that's in the Affordable Care Act called the Innovation Waiver. It's already there. It wasn't working, so we agreed to streamline it so that it would work. so that a state might make an application and say, we have a better idea. And we said, you can't change the essential health benefits, or you can't change the prohibition on lifetime limits. You still have to give people an offer of insurance if they have a pre-existing condition. All of those provisions and protections were still in our bill. But that new flexibility would have allowed Iowa and other states to increase their choices and lower premiums. It would have allowed New York, it would have allowed Minnesota, it would have allowed New Hampshire to do things their Democratic senators said they badly wanted to do, and their governors said they badly wanted to do. There was new authority for a catastrophic insurance policy with lower premiums, higher deductibles that people could choose. That was in there too. This is the package that the Oliver Wyman experts said would, if you're a contractor and you're making $60,000 and your insurance is $20,000, it could reduce your premium from $20,000 to $12,000 over 3 years. That was the package. Almost all Democrats liked those three ideas. The truth is, a lot of Republicans and conservative groups were skeptical of them because they said it would, quote, shore up Obamacare. But the Congressional Budget Office said that if the scoring reflect the cost-sharing payments being paid, our proposal would actually save taxpayers dollars by lowering premiums and therefore lowering subsidies. So this would sound like a very good proposal, wouldn't it? Something that at one point the Democratic leader said every Democrat could vote for. Something that more than half the Senate participated in. Reinsurance, cost-sharing subsidies, and more flexibility without changing the basic guarantees of the Affordable Care Act. That sounds very much like a proposal that might come from the other side of the aisle, not the Republican side of the aisle. Yet, on the Saturday before we passed the omnibus spending bill, President Trump called Speaker Ryan and he called Senator McConnell and he said, will you please put that provision in the omnibus spending bill? They said yes. The Democrats said no. So the Democrats have written this Obamacare bill, which for 6 years has raised rates, and then we come up with a proposal that every Democrat should like, and they say no. They won't even support changing one sentence of a law, even if it changes parts that don't work, that they're for. What was their reason? Here's their reason. They would not apply to our proposal the traditional Hyde Compromise language regarding federal funding for elective abortions. What that basically says is there may be no federal funding for elective abortions, but states may do what they want. That's been the compromise since 1976. Since 1976, in every omnibus appropriation bill, Democrats have voted for that. In this omnibus appropriation bill, well, in fact, all those weren't omnibus bills. Some of them were different appropriations bills. But since 1976, in every appropriation bill, Democrats have voted for the Hyde Amendment. In the omnibus appropriation bill that we passed last month, Democrats voted for the Hyde Amendment more than 100 times in other proposals, but they would not vote to lower health insurance rates by 40% over 3 years. I'll say that again. Even though they voted for the Hyde language every year since 1976, and they voted for it 100 times in the omnibus bill, they would not vote for it. They would not vote for our proposal to lower rates, even though it was bipartisan, because they didn't want to apply that same compromise Hyde Amendment to health insurance. Howard Baker, the senator majority leader, once said that the essence of Senate leadership is becoming an eloquent listener. That means hearing and understanding what people have to say, because what they are saying is not always what they mean. My conclusion is that by their words and by their actions, what Democrats really were saying is we won't change one sentence of Obamacare, even the parts that obviously are not working, and even when most of the Democrats would support the policy and the changes. Given the Democrats' attitude, Mr. President, I know of nothing that Republicans and Democrats can agree on to stabilize the individual health insurance market. I know of nothing. No one regrets Congress' failure to reach an agreement on this more than I do. I ran for the United States Senate because I want to achieve bipartisan results on important issues, and I've often been able to do that. But I literally struck out here. When Democrats blocked these proposals from being included in the omnibus in March 1 and said, now let's look down the road, insurance companies will announce their rates for 2019. Rates are going to continue to go up instead of down. They're right about that. Already in the last few days, rates have been announced that will go up in 2019. Millions of Americans will be hearing more about that. They could have worked with us, the Democrats, to lower premiums by 40%. They instead chose to cling to an unworkable law, to skyrocketing rates, and to reject any change that would have temporarily even reduced rates, even though the president and the Republican leaders were willing to support ideas the Democrats, as a matter of policy, almost unanimously support. So now, Mr. President, for relief, we'll have to turn to the Trump administration and to the states. I'm encouraged by Labor Secretary Acosta's proposed rule on association health plans. It would help some self-employed Americans like Marty the farmer and employees of small companies to buy the same kind of insurance with the same lower cost and the same protections that roughly 160 million Americans who work for large employers have today. In other words, if you work for IBM, you in effect get about a $5,000 average tax break because of the way the tax law applies to employer insurance. We'd like to give the same opportunity to the self-employed and to people in small businesses. The Trump administration has also proposed a rule that would reaffirm the role of states in regulating short-term health insurance. This could provide a coverage option for Americans who today are uninsured because plans in the Affordable Care Act markets are too expensive. Neither of these changes require the approval of Congress. I'm talking with Secretary Azar Seema Verma, the administrator of the Centers for Medicare and Medicaid Services, about other administrative actions they can take to give states more flexibility within the current law to help lower health insurance premiums, especially for the 9 million Americans who do not receive a federal subsidy in the individual market. Those are the ones who are getting hammered. Those are the ones whose rates we could have reduced by 40% over the next 3 years, but the Democrats said no. I will be encouraging governors and state insurance commissioners to do everything they can to repair the damage caused by the Affordable Care Act. But my own efforts as chairman of the Health Committee will now turn to other pressing health care issues, including the opioid crisis, overall health care costs, electronic health care records, prescription drug prices, and the 340B program. Contrary to the Democratic leader's speech, this is not a crisis of Republican making. Democrats should look in the mirror. The last 5 years and the upcoming 6 years of premium increases are the fault of a law designed, drafted, and voted on exclusively by Democrats. Last year, Republicans freed Americans from the individual mandate requirement, which was a tax on the poor that forced many Americans to buy insurance they couldn't afford or didn't meet their needs. And we tried to provide even more freedom from this unworkable law, but of course, as I've detailed, Democrats said no. So if you have an insurance premium that's going up 40% next year, on top of the more than 105% increases since 2013, you can thank the Democrats. And if you like greater choice and an opportunity for lower premiums, you should support Republicans. Thank you, Mr. President. I yield the floor.